We have a new guided on-site MRI mini fellowship, which is on wrist, hand, and elbow. And these are areas which people have a lot of difficulty with. The anatomy is difficult. The anatomy is very small. It's often really not taught that well when we're training. And it's something that often people will avoid when it comes onto their reporting list, because that confidence is there in being able to report it. This is something that you can definitely change. We will guide you through being able to see the radiological anatomy, that you need to know what the pathology looks like, how to make the diagnosis, and also how to structure a report. You have your own workstation with multiple diagrams, and we will go through those diagrams so that we actually display the diagrams, will show where the abnormalities are, will show you how to find these abnormalities. Then you can ask questions at any time, and I think that's a really important thing in any course or conference, where you are able to clear whatever doubts you have, and they may be the smallest of doubts, but it's very important to get them cleared. And on top of that, there's the background knowledge that you will learn. We've got lots of quizzes to help you retain the knowledge. The aim is at the end of this course is that you are much more confident reporting wrist, hand, and elbow MRI. So if that's something that you think will be of benefit to you in your work and your reporting, we'd be very happy to see you at one of our wrist, hand, and elbow MRI on-site courses.